I'm Dr. Tara. I'm a board certified dermatologist and founder of Tara MD, a virtual dermatology practice. If your skin feels rough, bumpy, or uneven, whether it's from acne scars, clogged pores, or dull skin, you're not alone. Textured skin is incredibly common, and while texture is normal, there are dermatologist-approved ingredients that can help smooth, brighten, and refine your skin tone over time. Let's talk about the best ones for skin of color and how to use them safely and effectively. Before we get into ingredients, let's get into why texture happens. Common causes of texture include buildup of dead skin cells, clogged pores and comedones, acne or post-acne scarring or post-acne marks, dehydrated skin or skin with a damaged skin barrier, and early signs of aging like fine wrinkles and volume loss. Understanding the causes can help you choose the right ingredient to target your concern. Here are the dermatologist-approved ingredients that I recommend most for textured skin. Number 1, retinoids. Retinol, tretinoin, adapalene. They help to stimulate cell turnover, smooth fine lines, aid pigmentation, or get rid of comedones, help to regulate sebum or oil production, and helps to reduce breakouts. So here's how you would use a retinoid. You would start 1 to 2 nights a week. Make sure that you're using a good cream-based moisturizer. Expect results that are gradual. This is a long game, but this is how retinoids work. Number 2, alpha hydroxy acids. One of my favorite being glycolic acid that help to chemically exfoliate the surface of your skin. So getting rid of all those dead skin cells that give you kind of the dull look, helps to brighten dull skin and improve skin texture. And here's how you would incorporate an AHA into your skincare regimen. So you would start 1 to 2 times a week. You can do a serum, toner, but try to avoid any harsh scrubs. Number 3 is BHAs. BHAs like salicylic acid, which I love, especially for those suffering from acne. Guess who's making a guest appearance? Say hi, Christopher. AHAs are great because they are... Crispy, get out of here. BHAs are great because they're oil soluble, which means that they're going to clear out the pores, clear out those gunked up pores. They're great for those people that have acne, blackheads, especially around like your T-zone, like your forehead, your chin, your nose. The best way to incorporate a BHA is to either use it as a spot treatment. So if you have areas that you're trying to target, say you have blackheads on your nose, focusing it on your nose, or if there are areas that you're prone to breaking out, like your forehead and your cheek, kind of targeting it to those areas, your forehead and your chin, kind of targeting it to those areas, or you could incorporate a serum 2 to 3 times a week. This is especially helpful for textured areas like the forehead, nose, and chin. Number 4 is niacinamide. Niacinamide works by helping to reduce inflammation, and it helps to improve skin texture over time. It also helps with pores, redness, and helps with barrier repair. You can incorporate niacinamide by using it daily, either morning or night. It's often found in serums, moisturizers, toners, and it pairs well with almost anything. Number 5 is azelaic acid. Azelaic acid helps to also treat acne, and it's safe for sensitive skin like those suffering from rosacea, fading pigmentation. You can incorporate azelaic acid by using it once or twice daily, depending on the formulation. And this is a great option for those of you that can't tolerate strong acids or retinoids. Number 6 is hyaluronic acid and ceramides. Hyaluronic acid is not exfoliant despite the name acid. Most people don't realize that texture worsens when your skin is dehydrated or if your skin barrier is compromised. Ingredients like hyaluronic acid and ceramides help to restore plumpness and smoothness and help to restore your skin's barrier. You can use hyaluronic acid by incorporating it daily. It can be found in serums as well as moisturizers. And think of hyaluronic acid as more of a support crew. It's always there to kind of hydrate your skin and can be used with other ingredients. Here's what a texture targeting routine might look like. In the morning, you would start with your gentle cleanser. Then you would consider adding a niacinamide serum or a hyaluronic acid serum. Then you would follow up with a lightweight moisturizer, and you would conclude with your sunscreen SPF 30 or more. In the evening, You can alternate nightly. So on night 1, you would use your retinol and your moisturizer. And night 2, you would use your AHA or your BHA and your moisturizer. Night 3, this would be your barrier repair night. So you would just use hydrating products like your hyaluronic acid and your moisturizer. And then you would just repeat that nightly. Here's a pro tip. Don't mix all your actives at once. Over exfoliating can lead to inflammation, which can result in more texture. So texture takes time. You're encouraging your skin to turn over, heal, and rebuild itself, and that cannot be rushed. So here's a few tips. Introduce your new actives slowly. Always patch test. If you have a new product that you want to make sure you're not allergic to, you can apply it to your inner forearm for a few days to see if you're allergic. Always protect your progress with sunscreen. Don't forget to moisturize. Even oily skin needs hydration. And most importantly, give it at least 6 to 8 weeks before you evaluate for results. So let's recap. Number 1 ingredient, retinoids for cell turnover. Number 2, AHAs and BHAs for chemical exfoliation. Number 3, niacinamide for smoothing and calming. Number 4, azelaic acid, gentle resurfacing and pigment control. Number 5, barrier builders like hyaluronic acid and ceramides. Texture is common and progress is possible with a consistent, supportive routine. If you need help figuring out which ingredients are best for your skin, I offer virtual consultations where we can build your routine together. No guesswork. If this helps, save or share with someone you know that's working on their skin texture. And remember, skin doesn't have to be perfect to be healthy.